Hi, welcome to week 5, module 9, and we'll talk about telehealth and telemedicine and remote patient monitoring. We have 2 learning objectives: to define telehealth and remote patient monitoring, and to describe use cases for telehealth and remote patient monitoring. So with telehealth and telemedicine, many times you'll hear these terms being used interchangeably now. Back maybe about 8, 9, 10 years ago, there was a definite distinction where telemedicine was referring specifically to remote clinical services, such as doctor-patient visits, and telehealth was referring to remote non-clinical services, such as provider training, admin meetings, medical education, and other clinical services. But we're really starting to see an overlap here. And remote patient monitoring is a method of healthcare delivery that uses the latest advances in information technology to gather patient data. And that could be monitoring patients remotely with devices while they're in their homes, or at work, or monitoring patients in, we'll say, a critical care unit like an ICU, remotely by the vendor or from another institution. So some use cases for telehealth and remote patient monitoring. These could be clinic visits that are done over a video call or a video conference for patients who cannot travel in for their clinic visits. So think about a patient that has ALS. It can be extremely difficult and expensive to be able to get somebody who's in the later stages of the disease into a car and off to the hospital or the clinic. Even more challenging if there is no, like van or car, and they're relying on public transportation. This can also be used for rural areas where it may take hours to get to the most, the closest health delivery center. It can be clinician to clinician consults, or even bringing in a specialist during a primary care encounter, where maybe a primary care encounter with a nurse practitioner or some other advanced care practitioner needs to bring in a physician, or a specialist like a dermatologist or a cardiologist or psychiatrist. This can lower labor costs to be able to monitor critical care units virtually. There have been new payment rules recently announced from the Centers for Medicare and Medicaid Services for telemedicine. Hopefully this reimbursement will push telemedicine and telehealth services forward in the areas that are not currently taking advantage of the technology that we have. We have older populations now. America is getting older. There's still a shortage of primary care clinicians, and there's also an increase in chronic conditions. And this technology can also be used to share images remotely. So it's not always about having, a face-to-face encounter over a virtual web session between a clinician and a patient. It could be between 2 clinicians sharing images. As of the end of 2018, 2/3 of providers say Medicare and Medicaid reimbursement would accelerate telemedicine plans, and that is the prediction for 2019 to see much more of remote patient monitoring, telehealth, and telemedicine. So in summary, Gartner says to make virtual care digital transformation real by developing the capability for innovation sprints alongside the intentional use of design thinking tools. Engage your clinical and business stakeholders to assess how you currently support and measure the progress of your virtual care initiatives. Gartner also makes the assumptions that by 2023, U.S. emergency department visits will be reduced by 20 million due to enrollment of chronically ill patients in artificial intelligence or AI enhanced virtual care. And virtual encounters will exceed face-to-face care delivery encounters, resulting in a dramatic realignment of clinical care and health IT. And we're actually already seeing this at some well-known institutions where at Kaiser, for example, they have actually exceeded face-to-face delivery encounters with virtual encounters. So to continue on for this week, there are quite a few reading and video assignments on Canvas. There's an example in a video for you to watch, a short video clip, several news articles and journal articles for you to take a look at, along with a report that was just published from Gartner in December of 2018. So you can proceed to week 5, module 10, after completing those reading assignments. And there's also exercise 4 that you will want to complete by the end of the week. Thank you.